Assalamu alaikum everyone, and welcome back to my YouTube channel. If you are new to my channel, then subscribe to it and press the bell icon for the latest updates. Without wasting your time, let's start. Today, I will start another drug, that is antihistamine drugs. Before discussing, we should know about what is antihistamine drugs. Antihistamines are used to relieve or prevent the symptoms of hay fever and other types of allergy. They work by preventing the effects of a substance called histamine, which is produced by the body. Histamine can cause itching, sneezing, runny nose, and watery eyes. Now I will discuss the drug that is most commonly used is cetirizine. Origin: Daniel Bovet, Italian pharmacologist who received the 1957 Nobel Prize for Physiology or Medicine for his discoveries of certain chemotherapeutic agents, namely, sulfa drugs, antihistamines. Plant source of cetirizine is still unknown. Mainly it is chemically prepared. Dosage forms of cetirizine: mostly tablets forms. Capsules. Syrup. Mechanism of action of cetirizine. Cetirizine is a second-generation histamine H1 antagonist. Cetirizine competes with histamine for H1 receptor sites on effector cells in the gastrointestinal tract, blood vessels, and respiratory tract. Indication: allergic reaction. The side effects of cetirizine greater than 10% are drowsiness, headache, dry mouth. Many drugs that have interactions with cetirizine, but few important are followings. Do not use with ardafitinib, that will increase the level or effect of cetirizine by P-glycoprotein, NDR1, efflux transporter. Avoid or use alternate drug. If co-administration unavoidable, separate administration by at least 6 hours before or after administration of PGP substrates with narrow therapeutic index. Warnings and contraindications. Hypersensitivity to cetirizine hydrochloride or any of its ingredients, levocetirizine, or hydroxyzine. Cautions: avoid alcohol, sedatives, and tranquilizers, due to increased risk of drowsiness. May cause CNS depression. Avoid activities requiring mental alertness until accustomed to medication. Use caution in hepatic and renal impairment. General considerations: tell your doctor if you have or have ever had kidney or liver disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while taking cetirizine, call your doctor. You should know that cetirizine may make you drowsy. Monitoring parameters or tests cetirizine. The patients that use cetirizine should perform following tests. Patients taking cetirizine require monitoring for the relief of symptoms. Healthcare team members should also monitor patients for adverse effects such as fatigue and somnolence in adults and headaches in children. Commonly prescribed brands: tablet, Cetal 10 mg, tablet, Rigix 10 mg, tablet, Zyrtec 10 mg. Dose: 5 to 10 mg OD. If you enjoy this video is informative, then like, share and comment, and any question about this topic you can ask in comment section, and give me any suggestion about my lectures, and follow on LinkedIn. The link is in description section. Thanks for watching.